My name is Joy, and I'm an Actor Strategy worker at Moyo Health and Community Services. August 31st marks International Overdose Awareness Day, a time to honor those affected by substance use and to amplify voices that often go unheard. This video was produced by the African and Caribbean Council on HIV/AIDS in Ontario, ACHO. Through this documentary, we would share the lived experiences of African, Caribbean, and Black community members who have faced the dual challenges of substance use and HIV. We would hear from individuals who have battled substance use themselves, as well as from loved ones who have shared the journey by offering their support and empathy. Our goal is to foster understanding, reduce stigma, and highlight the critical need for culturally competent care and support.
The question, I guess, would be how HIV has affected me and how it ties into my addiction problems and how I got to be where I got to be. So I guess in 1996, I was homeless. I was addicted to drugs, living downtown on the streets. Doing that for a couple years, stealing and selling stuff just to survive and stuff. At some point, I guess it was in 1996, when we went walking out, a group of us was walking, and they had this little thing on the street that was saying, take your HIV test and get a coupon, a free McDonald's coupon or something like that. And I don't know, some months later, I got a message saying that, I should go to a place, a clinic or something, because something was up and they wanted to talk to me. And when I went down there, I remember going to a clinic that was across from Sherburne Station, where I met two gentlemen and who were trying to tell me, basically I was HIV positive.
A lot of people, especially in the ACB community, believe that people who use substances are being influenced by the devil. It is something that is rather demonized, and I think with that a lot of people do not really see the importance or the significance in educating themselves about, understanding how they can support people who use substances, how they can help to contribute to, the overall growth and holistic development of an individual who is using substances. We have to understand that people who use substances are people as well, people just like you and I, especially in this ACB community.
It's important to remember that 60% of ACB Canadians were born outside of Canada. This has serious implications for cultural retentions and cultural practices. This has caused many issues in relation to meeting upon this unfamiliar environment and substance use landscape.
Well, it started from a broken relationship. Having experienced a breakup, with somebody of my own ethnicity, that kind of sent me into a downward spiral. And that breakup was not dealt with in the most appropriate way. Whereas the only thing that I am left with now is to explore my curiosity as to how can I numb this pain, or how can I not feel the way I'm feeling now.
I think what we find when we're accessing services is that we're walking into spaces that don't understand our cultural needs, the languages we speak, the narratives that come from our religious backgrounds and our households that might impact how we disclose or how we share what our needs are in medical settings, social service settings. And when we think about our community that faces so many different levels of stigma, we're talking about stigma within institutions, but what about self-stigma? What about the beliefs and feelings that we hold within ourselves that continue to perpetuate that blame and shame? When we're providing support, we need to understand that this stigma exists and we need to learn how to address it. We need to talk about the language that we use with each other, and we need to call out spaces that are maybe not using the best language to describe people who use drugs or people living with HIV.
I don't like to use this term overdose. I hear it being thrown around a lot. And again, overdose means that you deliberately did something, knowing that you did something, you might have did too much of it, and that's not the scenario. So we have to speak on this straight. No more overdose stuff. The drug supply is being poisoned, and in that manner, now we have to change our perspective and realize that these people that are consuming their drugs are being victimized. This is like any other crime, like any other assault, any other woundings or anything like that, because people are going to buy something, to do something and put themselves in a certain way, and they're being killed because of it.
In some instances, substance use is linked to isolation, which newcomers often feel as a result of being disconnected from family and friends and not having a social network.
So with the hurt and pain that I was feeling, I began to use substances. Tried one thing, which was weed. That did work for a little bit, but then now my curiosity got a little bit more open, and I tried something else. That experience again took me out of this world in a sense that I didn't feel in the present anymore. I didn't have to worry about the future anymore. I didn't have to worry about the past, about how I was feeling. And even in doing that, I was diagnosed with HIV in 2018. That experience, it was heart-shattering, because never would have thought that something like this could be a result of my decisions at the time. Even being diagnosed with HIV, that in of itself, which has a lot of stigma and discrimination in it and embedded in it, I started to feel lonely, isolated, and as if nobody cared.
Doing this work, I identify as someone with my own lived and living experience with substance use. When I had my first son, I was reported and accused of breastfeeding and smoking marijuana. That caused me to be drug tested for a number of years. And as I gave birth to other children, I was also drug tested, and this program was called Mother Risk. And it was found that through this program, there were faulty drug tests, and parents such as myself faced a number of barriers and challenges in regaining access and custody to our children based on many circumstances, but a lot circulating around these faulty tests. When we think about the numerous amount of Black and Indigenous children who are apprehended through the child surveillance system, we think of all the parents who don't have a voice and don't have spaces, such as myself, to speak of these injustices that we faced.
International Overdose Awareness Day is a significant moment, a moment that recognizes that harm reduction is something that really does work. Harm reduction is something that really saves lives. It is understanding that a lot of people are being affected by overdose deaths. There have been multiple occasions of overdose deaths.
as a part of the ACB diaspora, we have a problem with speaking about our relatives. For example, if our relatives have a mental health problem, we don't want to talk about the madman in our family. We're not going to talk about the madman. No, we're not going to talk about the crackhead. You know what I mean? And in those kind of ways, we kind of do way more harm than good. You know what I mean? We do way more harm than good because they're not crackheads. This is a person that is going through challenges, and they need to have support and assistance in their challenges.
In African, Caribbean, and Black communities, immigrants and refugees encounter various challenges such as language barriers, discrimination, and limited healthcare access. Our community suffers from heightened susceptibility to substance use due to systemic barriers and experiences of racism. Additionally, precarious living situations such as homelessness or unstable housing arrangements like couchsurfing further increase vulnerability to HIV transmission. This year's theme, Together We Can, urges us to create more access to culturally competent programming and to show empathy that leads to supportive actions and meaningful change in addressing these intersecting challenges. ACHO extends its heartfelt gratitude to those community members who have bravely shared their stories. Stigma forces many to struggle in silence, but by embracing this year's theme, we call on partners, families, and friends, and colleagues and systems to be intentional in our support and care as we confront this crisis. Our community is counting on us.